Hello and welcome to this Friday weekly webinar. Today, to talk about integrating yoga therapy in the modern healthcare system, we have with us Dr. Meena Ramanathan ma'am, who is Deputy Director and Associate Professor, Center for Yoga Therapy Education and Research, Mahatma Gandhi Medical College and Research Institute, Shri Balaji Vidyapeeth, Pondicherry. I heartily welcome you, ma'am. We also have with us Director of Morarji Desai National Institute of Yoga, Dr. Ishwar V. Basavaraddi sir with us. I heartily welcome you, sir.
Thank you, Dr. Vandana. Thank you.
We also have Communication and Documentation Officer of MDNIY, Mohammad Tayyib Alam sir with us. I heartily welcome you, sir. Now, without any further ado, let us start the program with prayer. Om Sahanavavatu Sahano Bhunaktu Sahaviryam Karvavahai Tejasvinavadhitamastu Ma Vidvishavahai. Om Shanti Shanti Shanti. It is our extreme pleasure that Dr. Meena Ramanathan ma'am has accepted our invitation and joined us today for this webinar. I once again welcome you, ma'am, to this platform. It is our great pleasure.
Thank you and namaste.
I also welcome Dr. Ishwar V. Basavaraddi, sir, Director of MDNIY, to this platform. I heartily welcome you, sir. And I also welcome Mohammad Tayyib Alam sir to this platform as well. I heartily welcome you, sir, once again. And now I would like to request Communication and Documentation Officer of MDNIY for further proceedings. Sir, over to you.
Thank you. Thank you, Dr. Vandana. Good evening, everyone. Today we have with us respected Dr. Meena Ramanathan ma'am, Associate Professor and Deputy Director of CYTER, the Center for Yoga Therapy Education and Research at Mahatma Gandhi Medical College Research Institute, Sri Balaji Vidyapeeth, deemed to be University, Pondicherry. Ma'am will talk upon the topic integrating yoga therapy in the modern healthcare system. Dr. Meena ma'am is a recognized IUIT certified yoga therapist by the International Association of Yoga Therapists USA. She has received many awards and recently one of them is the Achievers Award for Best Yoga Therapist. She is also the task force member that has been constituted to guide and monitor the activity of CSIR, Traditional Knowledge Digital Library Project, Government of India, on digitization of Indian system of medicine. Dr. Meena ma'am is appointed as the journal editor along with Dr. Lori Robinstein Fazio and Dr. Melissa Sullivan for the Journal of Applied Yoga Science, Lolo Law School, USA. She has authored and co-authored a dozen of books and more than 3 dozen papers on yoga in English and Tamil in various journals. Ma'am has published more than 72 scientific papers and 25 abstracts in leading scientific journals. Dr. Meena ma'am has been featured in the Real Marigold Hotel Series 1 episode in BBC in United Kingdom. Thank you, ma'am, for accepting our invitation for Friday webinar, which has been organizing since 2nd October 2022 on every Friday. So it's since 2nd October 2020 on every Friday, and it is quite popular in different social media platforms of the Institute, as well as the Ministry of Ayush and other social media platforms. With these few words, I would like to invite respected Dr. Ishwar V. Basavaraddi sir, Director Morarji Desai Institute, to say a few words about this topic. So,
Very good.
Shanti Shanti. Today's esteemed speaker of this Friday National Weekly Webinar, Dr. Meena Ramanathan ji, my colleagues in the Institute, Shri Tayabalam ji, Dr. Vandana, faculty members, and student friends, yoga enthusiasts joining this webinar from different social media platforms across the globe. My thanks to you all and hearty welcome to you all. As informed by my colleague Shri Tayab our Friday webinar was on 2nd October 2020. It's a very popular event, and we not only conduct this regularly, but we are also publishing the talks in the e-format so that the knowledge of the scholars may reach as many people as possible through various media platforms. It may be print media, it may be social media, or any other media. So the idea is to impart the knowledge and skills to improve the quality of life and for general health and well-being. The second one is today's speaker, Dr. Meena, is a very proud student of our renowned yoga master, Meenakshi Devi Bhavanani ji, and then very proud disciple of Dr. Anand Balyogi ji. Both of them groomed her from last more than 3 decades. So I had opportunity with this from 1991-92 with Meenakshi Devi Madam and Dr. Anand ji. They are very simple and very traditional. And during my earlier days of my profession, kind of love, affection shown by particularly yoga master Meenakshi Devi Bhavanani ji was very immense. Whenever I remember Dr. Meena, and it's my privilege to remember both the masters who earned a name by their knowledge and act of promotion and development of yoga across the globe. The third aspect is Dr. Meena was sharing our platform many times during National Yoga Week. The last more than a decade, she has groomed and rose to the height, and it is very happy to see now she is deputy director and working as associate professor in the prestigious Mahatma Gandhi Medical College, Balaji Vidyapeeth, Pondicherry, where Dr. Anand Balyogi is the director of the center. So under their leadership, they are conducting diploma courses for the medicos and yoga therapy, conducting research and etc. With this background, both of them also shared the platforms of JIPMER. They worked in JIPMER for long years, and now in the Balaji Medical, in the Mahatma Gandhi Medical College of Balaji Vidyapeeth, Pondicherry, deemed university. So, with this rich experience, the topic chosen for today is that is integrating yoga therapy in the modern healthcare system is very appropriate. I do hope that the teachings or the talk by Dr. Meena definitely throw new light on the integration of yoga in the modern healthcare delivery systems. So I congratulate her, and I'm always see the growth of our friends and also the students. I enjoy silently their growth, and it's one of the proud moment. Now the last point is, as I said, yoga was relevant 5,000 years back, part of our culture, part of our life. Yoga is relevant till today also, and will be relevant in the coming days. Yoga has that power. But one of the important dimensions, yoga has several dimensions. So one of their important dimension is healthcare. Healthcare now, maybe modern medical or in the Ayush healthcare. That's why I am not distinguishing the modern medical or Ayush, because in Ayush also yoga is being integrated in Ayurveda, Siddha, Unani, homeopathy, naturopathy. Yoga has become an integral part. Because for two important reasons. One is all these indigenous and systems of medicine, they are holistic, and mind management an important component. Yoga is the only system which advocates how to manage the mind and its impact on our body. The second one, the modern medicine also realize the importance of yoga practices, asana, pranayama, meditation, in the stress and its consequences, the management of non-communicable diseases, and especially in the metabolic disorders. So research has shown yoga can be an adjunctive therapy. Even in Korea, China, they are having the traditional medicine, and as you know, MDNY is a WHOCC. We meet many Southeast Asia region collaborative centers. So where these are the things where other systems, like if you go to Germany, they have a different physical exercises. So for that, it is anthropometry. So they are using it. Same thing in Tai Chi, and other formats are there in different Asian countries. So, but yoga has established globally because of its credentials. Now it is high time to think about it, make the strong principles, concepts, and the practices for different disease specific, and later on individual specific also, because yoga goes with it. In the long run, it's a ongoing process, so that it can become an integral part of our all healthcare delivery system. So for this, we need the thorough understanding of yoga, and also understanding of modern medical system and Ayush systems, or different traditional medicine. I take the word as a traditional medicine system. So this is the need of the hour, and that's going on. Today's talk may enlighten that. Last, because it's a non-pharmacological, and it's a cost-effective and people-friendly. So these are the dimensions of yoga where people adopt, and it is unbiased, and it's a science basically. And we have to present it. What are the challenges? In yoga, it is experiential. In modern science, it is experimental. So once we bring the bridge between experiential and experimental, somewhere blending both sides, then there is a meaningful marriage and being together. These few introductory remarks. Now I request Dr. Meena to address our students and faculty on the topic integrating yoga therapy in the modern healthcare delivery system. Dr. Meena.
Thank you, Basavaraddi ji. Thank you so much. Thanking the organizers, the director, sir, Dr. Vandana ji, and the technical assistant, Dr. Rishi ji. All of you, thank you so much for assisting me and for this wonderful opportunity to be sharing a few thoughts in this esteemed platform. So it's my pleasure and privilege to be a part of your this platform here, And let me just share a few of the thoughts. And yes, I hope you can see my screen now.
Yes, ma'am. Yes.
Yeah, okay. So again, as they all have told you how it is like the need of the hour, integrating yoga therapy in a modern healthcare system. And Basavaraddi ji has given such a beautiful introduction to this whole topic. And, with deep sense of acknowledgement, I thank my guru, Dr. Anandapalyogi sir, who's magnanimously accepted for me to use a few of our slides that we have, that he has prepared. And so what is yoga? It is a way of life, a discipline. Anything and everything can be brought under this, because yoga is to integrate, to harmonize. So what is it that it is putting together? It is putting together all the broken aspects. So what is broken? It's like the body, mind, and the connectivity between the body, mind, because of our existence, everyday existence, the stress and everything else that is happening. There is a general disagreement. And what is yoga doing now? It is trying to pacify, it is trying to bridge and try to bring all these fragmented parts put together. So that is what yoga's whole connectivity, it is bringing back the connectivity that is lost. So bringing back the integration, and it can integrate and be a complement to all the other modalities of therapies and treatments also. And it is a conscious process of evolution. We are elevating ourselves from the low level to a higher level, and up to the divine level, sama adi. So every step we are elevating through the yoga aspects and concepts that we are following in yoga. So basically, what is yoga therapy all about? It is the process of empowering. So people who have lost that sense of ease within themselves, yoga therapy and yoga concepts and practices, we are advocating so that we can bring them back into that state of sukha and regain the state of ease that they have lost. So towards the improved health and well-being of that person, and empowering them to regain all that through these concepts and practices in yoga, is what yoga therapy is all about. So as we are going to be talking about the healthcare system and how do we integrate the traditional science, art, and philosophy called yoga here, we need to understand what health is and how has the different definitions of health. So WHO's definition of health is, it is not just the absence of disease or infirmity, but it is the presence, it is a dynamic state of complete sense of well-being in all the spheres of our existence, the physical, mental, social, and recently they have also added up the spiritual well-being. And what has Acharya Sushruta ji defined health as, he has called it as swastha. Swastha meaning it is not again absence of disease, not just the balance in all the physiological functions, but it also involves prasanna atma indriya. So samadosha samagnischa samadhatu malakriya prasanna atma indriya. So beyond all the physiological functions, we also have to take into consideration the manas and the indriya and everything which is in a balanced and tranquil state. So that promoting a contented soul. And Maharishi Patanjali ji has given us this beautiful thing called Ashtanga Yoga ages back, relating to all this, the social health through achieving that through the Yama and Niyama, the physical health through Asana and Pranayama, mental health through Pratyahara and Dharana, and spiritual health through the Jhana and Samadhi. So one thing we need to understand is that all these different levels of our existence is like each one is connected, interconnected with the other. So physical well-being is connected with the mental, connected with the social. It is not separate, different compartments. Each one is connected with the other, that a small disturbance happening in one sphere is going to affect the whole of the equilibrium. And so what is going to happen if something is happening in the social well-being? It is going to affect the other spheres. Say for example, the mental health well-being is lost and the physical well-being is lost. So it is all connected, and the what we see is only the gross aspect, that is the physical well-being, but the others are also there, which has to be taken into consideration if we are talking about holistic health and well-being. And we also have to understand that it is a dynamic state and it is a continuum. Health is seen as a dynamic movement. It is a continuum between total ill health, which is disease, and total health, which is the state of ease. Disease means dukkha and ease means sukha. So how are you going to promote that state of sukha? So as long as you are at ease with yourself, you are in that state of sukha, the sukha sthanam, as we say. The moment you lose that sense of ease within, what happens? You end up having this ease. So how do you regain that sukha back is what this whole journey is all about. So the modern perspective of human body, as we all know, consists of, the cells, tissues, organs, organ systems, the physiological functioning of each organs. Again, the organ systems are all interconnected. So we need to understand and keep in mind always the interconnectivity between the different levels. And how does yoga perceive a human being? Yoga perspective of human being is, it is more than one level of existence. It is expanded as given in our CYTER Upanishad, the Pancha Koshas, the Annamaya, Pranamaya, Manomaya, Vijnanamaya, and Anandamaya. So different levels of existence of the human being. So WHO, they had a traditional, they formulated a traditional medicine strategy, which was a policy devised 2014 to 2023, which was mainly to integrate all the traditional and the complementary practices for the benefit and well-being of the whole global community. So this is like what used to be an alternative system, now slowly got promoted into CAM therapy, which is complementary and alternative. And now it is being called as traditional, complementary, and integrative medicine. So we are trying to put together, and as Basavaraddi ji very rightly put, said in the introduction, yoga is a non-pharmacological modality. So it can complement and it can gel and act together hand in hand with all the other different modalities, because it is non-pharmacological and we are focusing on the mind. Again, trying to integrate. So being that integrative science, we can integrate and connect all the aspects, and we can also connect with the other modalities very, very easily. And so now we are moving towards the traditional, complementary, integrative medicine. It is not just you or me, whereas in the alternative, it is you and me in the complementary. But when it becomes integrative, it is all of us together, hand in hand. So we can promote ourselves better. So while we are thinking about integrating this beautiful system into the modern healthcare system, do we actually need this integration? That is one question. Why do we need this integration? And where these are a few questions, if we answer, I think I'll be able to justify a little bit about the topic that is being discussed today. So where can this integration happen? And how can we promote this integration and enable it to be manifest? We need to integrate. We need to integrate it because there's a lot of similarity and there are a few differences between these two grand sciences, the modern medicine as well as the yoga therapy. Yoga. So these two are different grand sciences, the allopathic medicine. But the similarities being, the good points, the meeting points being, both, we are focusing on promoting the total health in the seeker. and both are scientific, rational with a universal outlook, and both have the strengths and weaknesses. So, but the only good thing is that the strength of the modern medicine is the weakness of yoga, and the strength of yoga is the weakness of modern medicine. So if you can see, they complement each other so well that they can fit, like a lock fits into the key fits into the lock. So it is like as if they are made for each other. The things that yoga cannot do, modern medicine can step in. The places where modern medicine has no answers, yoga steps in. So by putting these two together, there's a beautiful sense of health and well-being which is being promoted. And now this is like a global phenomenon that is happening everywhere, and for the benefit of promoting a sense of health and wellness in the whole of the humanity. So the strengths again, like I said, vice versa. And so where can this integration happen? So when we are focusing, wherever we are focusing on the psychosomatic health, so mind being the cause of the soma, affecting the soma, adhija vyadi, like we say. So what happens in the adi, your mind, the disturbances and distractions happening, how does it end up percolating? Like, we saw about the different koshas percolating down, affecting your prana, my kosha, and coming down into your body as a vyadi, settling down. So adija vyadi, the psychosomatic, and the somatopsychic vyadija adi. So all these, wherever these are being dealt, these the modalities can be put together. And wherever we are managing stress management, this is the best area. Boosting immunity, lifestyle disorders, where there is no other answer other than bringing in yoga therapy and integrating it with the other modalities. And pre-op relaxation, which is very, very essential, because we see it every day in our hospital, where we go in and give a few techniques. We have also done a study on that, where the anxiety levels of the patient who before the surgery, it is too high. So by giving them a few techniques and breathing techniques, just to cool down, to calm down, Chandranadi pranayama, Pranava pranayama, how is that helping them? One is the anxiety is brought down immediately, so that they are able to go into a surgery with a very calm state of mind. And so the post-operative recovery is very, very fast. So these are areas where we are kind of integrating there and stepping in. And where drugs fail, there are a few situations which I have to give you an example. In dermatology, we had a patient, and they had tried all the medicine for psoriasis. That lady was suffering with psoriasis, and every medicine under the sky was tried. And dermatology ward is next to our yoga therapy unit center. So what happened? The doctors really got fed up. She has been admitted for so long, and there was nothing that they could do with her. So she has been like eating their head. What next? What next? And they said like, okay, go to yoga therapy. So that was how she came to yoga therapy. And after doing yoga for 1 week, she started responding to the medicine. Methotrexate is the medicine which is normally given to them. Where she was not responding to any medicine, now she started responding to the medicine, and she slowly started curing. It took maybe 6 months for her to come back, but she started regaining that sense of wellness again when yoga was given to her. So all the stress related disorders can be addressed, because where drugs fail, we can step in to improve the potency of the drugs. And non-communicable diseases, all these are areas where we can see that integration happening. And thanks to the pioneer of this whole work, integrating yoga in a modern medical setup, thanks to Dr. Madan Mohan sir, who is our mentor, the Bhishmacharyas, as we call him fondly, where they are not, he made sense. They are saying yoga and modern medicine are not antagonistic, but they are indeed complementary modalities. And allopathy can add years to life, but yoga adds not just years to life, but also life to those years. So that is where it's something special. So how do we bring about this integration? This is where CYTER can be, put in as a model center where we are doing it practically, inculcating the yoga practices and yoga concepts and theory into the modern medical setup in a hospital. We are a center which we are situated, placed right in the middle of the hospital. So all the doctors in the hospital, as far as they are concerned, yoga is another department for them, where they, as they give referrals to the other consultations, they also send the patients to yoga therapy if they feel that yoga therapy might help. And the other good thing is that as a center in a modern setup, we work as an adjuvant therapy center, where the modern medicine is continued for the patient, and along with that yoga is given. So that is where this complementary aspect is also working for us. So the traditional modalities of the healing, yogic healing, integrated with the modern medicine. And what is it? Why are we doing all this? Ultimately, who are the who get the benefits? It is the seekers, the patients who come in and getting the wellness factor in them. What is lost, they regain. So that is something which is really beautiful about it, because we focus on something called as salutogenesis. So what is this? This might be a new term for you. Salutogenesis, meaning salus means health. So how do we promote the health? So these are the factors that promote health. So our focus is on the factors which promote health, instead of focusing on pathogenesis, which is what the modern medicine focus, the diagnosis, what is the problem. So instead of focusing on the factors that are causing the diseases, which is causing the problem, we are focusing on the factors which are promoting the health. So that is where the whole difference between pathogenesis and salutogenesis steps in. Salutogenesis is much better, where that is where this state of swastha is promoted. Swastha meaning the holistic health. Whereas if you talk about pathogenesis, it is like how we call it as arogya. It is a term again for health, but it is without, devoid of roga. So without disease is arogya. But what has all the definitions told us? It is beyond that, not just a state of absence of diseases or infirmity. So that is where salutogenesis steps in. This term was this has been coined by Aaron Antonovsky. You can like browse on that, and there's so much that we can relate as yoga therapists. We can relate to that concept so very well. And where is our focus? Our focus is on helping the patients recover completely from whatever illness they are facing, through the yoga therapy that we give them. So integration of these yoga therapy with the modern medical to ensure this, and positive health, promoting positive health in the patients. So as you can see, a few representative samples. We go right into all the post-operative wards, all the wards. If you can see a picture here, where we are working in the psychiatry ward. Every day we go in and work with the psychiatry patients who are inpatients, outpatients. We have an OPD consultation at CYTER, and you can see how the patients are being helped with yoga therapy. So as you can see, the clinical services, including various departments, for example, neurology, psychiatry and dermatology, orthopedics, pulmonology, obs and gynae, and general medicine. So we've had more than 80,000 patients visiting our department and getting benefited. And like I told you, it is an adjuvant yoga therapy we are doing. So whatever modality of treatment they are following, we never tell them to stop it. Along with that, as a complement, additionally as an adjuvant, yoga is also given. But we have found that yoga stops as an adjuvant, halts the progression of the disease, whatever it is. And we have also done a study on COPD and diabetic lung and many conditions, where we found that the quality of life of the patient is being enhanced. As we go on, I'll just share a few of those slides also. And master health check, all the packages in our hospital, the master health check, yoga is a part of the consultations that are going on in all the packages, starting from the basic package up to the most advanced package. So all that. And we have a rural health center also, where we go in and visit. So along with the case sheet, the modern medical doctors, they have a case sheet. They have the diagnosis, the tests that are being done, blood tests, x-rays, all those reports are given to them. And along with that, the diagnosis written by the doctor, it is brought to us, with the referral to yoga, and the patient comes in with that. So with that modern, the diagnosis that is there, we also take a look on the other yogic diagnosis. We have created this, diagnostic tool at our center, and we have also copyrighted this, the Yoga Chikitsa Anukrama, where we look upon various other factors and these, diagnostic tools as given by Dr. Swami Geetanandagiri Guru Maharaj, and we follow that tradition, and we are going accordingly. So we have the medical diagnosis, and we also have this yogic diagnostic tool that is there. And so these are a few of the factors which we consider. 12 different points. We sit and have a talk with them, we consult them, and we come up with, a basic assessment. And accordingly, we plan the schedule for that particular problem for that particular person. So it is a patient consultation, and then the schedule that is being, like Maharishi Patanjali says, Heya Hetu Hana Upaya. So what is the cause that is triggered this problem? So it is not just the symptomatic thing that we talk about. We are also talking about why this happened. So we go into the root cause. Hey, Hetu, and then Hana, what is their goal? Where do they want to go? So what is it that they are looking for? And then comes Upaya, the techniques, the yogic techniques that we add up as a schedule, a protocol that is devised for this person. And we also have yoga therapy courses starting from certificate to PhD in yoga therapy, and where the therapists are being trained to treat all these, because the demand is increasing day by day, because this has become a household word now, yoga. So everybody is seeking relief, not just from one modality. They are looking for, and the awareness factor. Everybody knows that, internet, you just browse and they get all the information there in their hand. So they want more. They are not just listening to one thing, they want more. So that is another aspect that we are looking at. And the other third aspect is the research, where scientifically researching hows and whys of yoga, where the traditional treatment, we are trying to put it into, what has been experiential, we are trying to make it, as a quantitative aspect, so that the scientific community is going to accept us also. So all the qualitative, quantitative research evidence for the application of yoga as a preventive, promotive, rehabilitative, and a curative therapy. So all these aspects are being covered. And investigating the role of yoga therapy as a complementary medicine is being done, and again, like an adjuvant to the standard medical care. So what is it? What is the significance of such a center in a healthcare setting? So one is like the holistic integration, as the word yoga, yuj, means the connection. So the holistic integration of these grand sciences happening, which is again enhancing the patient care. So for the benefit of the patient, the holistic benefit, of course, and effective in preventing and combating the modern lifestyle and the stress-borne diseases. So maybe 70 to 80% of the problems that man is, succumbing to is related to these, the lifestyle disorders and the stress-related disorders. And scientific evidence indicates that yoga helps reduce the drug dosage. So like I was telling you, a patient of COPD or a patient with diabetic lung, what is happening to them? The drug dosage could be reduced. They are retracing, they are getting well. What could not be addressed with only the modern medicine, by adding yoga to it, this is being addressed. So that is what we found with all the studies that we are doing there. And it's a continuum again. So ultimately, what are we looking at is the quality of life of the patient. Like we were saying, the Sukha Sthanam. How do you regain that state of Sukha Sthanam as a lifestyle adjunct? So that is what is being seen again and again. I'm sorry. Adjuvant yoga therapy seem to halt the disease progression. And we definitely, the yoga therapists have to work in tandem together with the medical doctors, again, for the holistic benefit of all of us. So the other main thing in yoga therapy, the most important thing, and which is very, very unique to yoga, is relaxation. This is the key to healing. And we in yoga, we follow this very, very stringently, because this is the central principle of yoga and yoga therapy, which is a very, very good prerequisite for healing. Because as long as you're holding tight, as long as you're anxious, as long as you're stressed, you're holding tight, you cannot let go and you cannot heal. So you are always, going back into that state of anxiety. See, if you can see this picture, anybody consulting, they say, relax, relax, relax. Is that how we promote the relaxation? The doctors keep telling the patients, you have to relax, you have to let go of the stress, but the patient doesn't know how to do it. So that is where, we step in, and by helping them to understand what relaxation means and how to go about to promote the relaxation. So in that state of relaxation, what is happening, what is it that you're experiencing, what are you letting go of, so that you can connect within, all the fragmented parts of you. How can you put them together? That is something that you understand in that state of relaxation. So how to educe the relaxation response is something, the unique feature of what yoga is all about. And that is where we are really blessed to be placed in this hospital, where we see it happening every day. And it's such a blessing to be there, actually. And this, as we say, is a boon to the modern society. And as you see, so many publications, and in all these aspects, we have done studies, and we have scientifically established it also. And yoga vyasa, this is another thing which I have to tell you about, because all the streams of the students who are admitted, because this is a university which has the medical college, dental college, nursing college, allied health sciences, pharmacy college, physiotherapy. So all these streams are there, and all the students who join into all these streams get yoga, right from the beginning. So they get a feel of this, they get the experience of what yoga is all about, that they are promoting it, and they ready. One is for their own self, help, because self-care is also important. If they have to be strong enough and healthy enough, that they can take it forward too. So they experience this, so that they can promote it, and they can recommend it to others who are in need when they become doctors and when they become consultants. So you can see that we go right into the classrooms, into the orientation sessions, all the sessions there, all the streams. You can see the nursing students, the medical students, and the nursing trainees. These are the nursing recruits. So all the nurses who get training to become nurses, all of them, even beginning before they are training, all of them get, and all the staff and faculty and the employees of SBV get a yoga session, weekly yoga session. And we have found that the reduction of 48% in their anxiety levels after even a single yoga session. You can see, as a few representative samples of all of them having a session of yoga, right up to the cleaning staff. And in the COVID wards, this is the most recent thing. We have the hospital where the patients with COVID are admitted, and you can see our instructors in the PPE kits going and giving them yoga. And what we found with this was that the long COVID symptoms, those who were admitted here and those who underwent these yoga practices, the long COVID symptoms are completely absent. And we also took it forward as a part of the home care package, e-healthcare services of our university. We have taken it forward to the comfort of their homes also. And this is one study which we did with the burnout and the stress in the healthcare providers. As you all know, the last 2-3 years has been like a total pandemic situation, where the healthcare providers have been in tremendous stress, managing the number of patients, the load, and they have been under tremendous burnout. So we found that with a simple yoga session, what happened was that their systolic blood pressure came down, diastolic blood pressure, heart rate, all this came down, and there was a very significant enhancement of the oxygen levels in them, improvement in all this. And the recent study that we have done with just one technique of yoga, that is the pranava pranayama, on the oxygen saturation and the heart rate variability, and we found that oxygen levels are being enhanced and the heart rate is coming down. So the stress levels are being taken care of, be reduced, and the oxygen levels are also getting enhanced very, very significantly with just one technique, the pranava pranayama, 10 minutes of the practice. So that I think everybody can afford to spend time. And this is another retrospective study. So all the patients who come into for yoga therapy, we take BP and heart rate, we recorded before and after the session. So this is data of around 4,620 patients, different conditions. See, as you can see, the endocrine, the respiratory. So all these patients, number of patients who came in. And what is the final result is that heart rate, systolic, diastolic, significantly coming down after even one single session of yoga therapy. So that is something which is very, very, which is a proud moment for all of us, that we can raise our collars up. Because through this, by alleviating the stress levels, we can cure so many other issues. And these are a few publications that we've done as a interdisciplinary activity with the other departments in our college and hospital. As you can see, in depression, so with the psychiatry, and this is sleep deprivation and autonomic functioning in perceived stress. And this is the experiences of the patients that they have in the hospital setup in the psychiatry ward. All these papers have been written by anthropologist, because he observed this and he has taken this up and he's written all these papers, how it is benefiting the patients admitted in the psychiatric wards. And this is another thing which we are very, very proud of, and which we are very, very satisfied. And this is something, which is very, very close to our heart. The outreach activities that through our university, we reach out to the underserved, underprivileged populations of the society, namely the children with the special needs, through the Divyanga Yoga, and the elderly senior citizens through the Silva Yoga, and the transgender population of our community, the local community, through the third gender yoga. And we have also had these as the best practices. If you can see a few representative samples of how the special children are doing all these practices, and these are the transgenders who are also involved in these practices, and these are a few samples of the senior citizen enjoying the practices there. And so all these best practices have been brought out as copyrights also. So we have 12 copyrights to our credit. And how is all this addressed? Because the base root cause of the problem is the stress, which is affecting your limbic system, the hypothalamus, the hypothalamo-pituitary adrenal axis, and the other one, the sympathoadrenal medullary axis. So causing a lot of the hormonal ejection into your bloodstream. So how do you regain back that health? Anytime the stressor affects you, all these are happening. All these, the stressor is affecting all the levels of your existence, causing that disconnection to happen. So how do you bring it back? Through yoga, through your mind. So the connectivity between the subtle aspect and the gross aspect, where is that connectivity happening? So the mind being the subtle aspect, and all these systems, the nervous system, through your brain, through your endocrine system, through the connectivity being so beautifully promoted through the practices in yoga, be it a simple deep breathing technique, or be it pranayama, asana, through various techniques, or an integrated schedule of the whole thing, and of course the relaxation, and crossing coming beyond all these religious barriers and boundaries, we are reaching out to the other sectors of the population who willingly come into our center and who willingly invite us also over to their places to conduct the awareness programs. And this is something which is very, very close to our heart again. So what are the current trends now? Government of India is promoting all these indigenous systems strongly through the Ministry of Ayush, and holistic integration of all this, enabling quality patient care, as the limitations of one is the strength of the other. So how can we bring these both together for the benefit? And Shri Balaji Vidyapeeth, it is promoting and supporting all these innovative things to happen, along with the cultural heritage. The modern things are also happening there. So how are we doing it? So setting up more such integrative centers, health centers, is very much the need of the hour for the benefit of the humanity. So as Timothy McCall says, ultimately science and yoga should not be seen as competing with each other. What yoga does complements the modern medicine strength, providing more options for the people in need of healing. And the same thing vice versa also. So curing and healing, what is the basic difference? So what is curing? It is the external treatment to remove the evidence of disease, and done by a physician, and usually done on the physical level. So you cure, and all the parameters, say for example, your blood pressure is normal, your sugar levels are within the range, normal range, but the patient still says, I don't feel well, I don't feel good, there's something that is not okay with me, but the parameters are okay, right? So we look upon that also. Where is it that we promote that curing into the healing component, which is an internal process through all the positive changes that are being promoted and the connection that is being regained. And this is done by the patient as an experiential aspect. And this compasses the whole person, all the spheres of the human existence. So that is where the healing is promoted. So the healing is actually the salutogenic paradigm, and curing is again the pathogenic paradigm. So this is something which we have to keep in mind. So yoga chikitsa is becoming global, supported by all the scientific evidences, and of the therapeutic potential which is being promoted everywhere now. In our zest to make this popular, we must not miss out on the experiential aspect. So that is very, very, very unique and special feature of yoga, which we have to very, very carefully guard that and keep it intact. And healing potential of yoga chikitsa depends on us, the conduits of yoga therapy. So we are responsible in transmitting it properly in the proper sense without losing its essence. So how do you get back the state of sukha sthanam, from that state of dukkha? So bringing them from that into the state of sukha is what this whole journey is all about. So managing and suppressing the symptoms, the manifest symptoms, without trying to address the root cause or correct the root cause. Using medicine is allopathy, and pati, as you know, is nothing but suffering and the symptomatic treatment. And through yoga technique, if we are going to be doing the same thing, it is nothing but yogopathy, as the term being coined by Dr. Andabal Yogi sir. And so what do we need to think about? Is it enough to just work on the body level, or do we go beyond that? But the need of the hour is, of course, the symbiotic relationship between these two grand master sciences. And so promoting that connectivity to come in, promoting that complementary aspects for the holistic benefit of the seekers who come in seeking these both to, where in a hospital, this is being promoted practically. So that is something which we've been discussing about. So I'm ready to take all your doubts or any discussions that you want to do. So may we all be blessed to travel in this yogic journey. So Hari Om Tat Sat.
Thank you so much, ma'am, for this wonderful and insightful lecture.
Thank you.
I just hope that I have kept up to the timing.
Yes,
Yeah,
ma'am.
very good. Nowadays, if it is more than 40 minutes or half an hour, total 45 minutes. We kept earlier 1 hour. But
Okay.
usually we would like to complete before 1.
Yeah.
Because people nowadays don't
Very
have
busy.
that patience. It was very wonderful. Vandana, you please take up the questions.
Yes, sir. Ma'am, as you said that salutogenesis is studies of origin of health and pathogenesis studies origin of diseases. Can you tell two more differences? As per my knowledge, as per my perception, I am getting that it is about the perception about we study health and diseases according to salutogenesis and pathogenesis. Somebody has asked, can you tell two more differences between salutogenesis and pathogenesis?
Pathogenesis is just promoting the health, whereas salutogenesis is promoting both health and wellness. So pathogenesis is again curing, right? But salutogenesis is healing. So inner connectivity, if we need to regain, because that is what is lost, and we have to regain the state of ease, the state of swastha. If we need that state of swastha, prasanna, atma, indriya, mana, right? That is what swastha is all about. So to regain that, we need to have a focus on the salutogenesis. Whereas pathogenesis is going to say arogya. So that's the basic difference. Arogya is devoid of roga. So there is no disease. So our previous vice chancellor, Professor Sethuraman sir, gave a beautiful example for this. There is somebody who's lost his car and he's gone and complained to the police, right? So this is the situation scenario. And there is a lot of stress that is happening now because it is a newly bought car and he's lost it. And, walking up and down to the police station. And ultimately, after a week or so, they have traced it, and they got the car back. So now the symptoms, as you say, is there. That is cured. You've got the car back. But the stress of this whole week, whatever they have undergone throughout this whole week, do you think the healing would have happened immediately?
No.
So that is going to take some time, where you have to completely now focus on your mind, completely focus on calming down, which is where salutogenesis steps. So you have to relax. And by relaxing means it is not like relax, 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 relax. You cannot relax. So you have to, kind of holding tight, you have to let go, throw it out. So that is going to take that. You need to make them understand that, because not many people know what is relaxation. How do I relax? Because to them, relaxation means stretching up the legs on the, some teepot and sitting back like this in a sofa and, having a packet of chips or something in hand, watching TV. Is that what relaxation is all about? What is happening in TV? They are watching a soap opera, a serial, where it is all what is being shown is stressful. The hero hitting the villain, they are scheming against him, somebody pointing a gun towards somebody, and you are responding to what is happening on screen. You are relaxing in your sofa. That's right. Your body is relaxing, but your mind is in that state of stress and tension. So that's again, the difference. So you need to relax, meaning achar, vichar, ahar, vihar, vyavahar. All these yogic concepts teach you, how to be healthy. Each and every aspect, if we can follow. That is why we say yoga is a way of life. It is not just 1 hour of practice that we do on the mat. After rolling the mat away, also we have to live these practices. So I hope that there is some clarification on that.
Yes, ma'am. Thank you so much, ma'am, for accepting our invitation and delivering such a wonderful lecture. I'm thanking you on behalf of Morarji Desai and all our viewers. Thank you so much. I would also like to thank Director Sir for joining us today and taking out time from his busy schedule. Thank you so much, sir.
All the best.
I would also like to thank Communication and Documentation Officer of MDNIY. Thank you, Tayyab sir. And I would also like to thank our technical team, Komal, Rishi, all of them. And thanks to all the viewers who have joined us today. Thank you so much. And we will now end the program with Shanti Part.
On my behalf also, I'm thanking each and every one of you for having given me this opportunity and this time. And thank you, Basavaraddi sir and Vandana ma'am and sir also, all of you. Thank you so much, all the viewers who's patiently been listening. Thank you.
Thank you. सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामया सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत् मा कश्चित् दुःखभाग् भवेत् ॐ शान्तिः 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 Thank you so much.